I'm Mr. Theddus Turi, the Chief Executive Officer for Jiwaka Provincial Health Authority. This morning we have two very, very important administrators from Kudjip Nazarene Hospital, Dr. Benjamin Radcliffe, who is the Chief Operating Officer, looking after Kudjip all operations in the hospital, and we have our Chief Executive Officer for Nazarene General Hospital, Mr. Joseph Sika. And they, I have my management team. To my left, I have Dr. Magadogu. He's the Deputy Director of Medical Services, and the two directors. Dr. Mariaska, she is the Director of Curative Services, looking after curative services, and we have Mr. Jakole, who is the Director for Corporate Services, and to my right and in the center is Mr. Rupanange, the Deputy Director for Finance and Administration. We as a team, we are gathered this morning, and there are so many things happening in the social media platforms regarding the notice that was put out by Kudjip Nazarene Hospital, the intention to close the hospital if they don't get the balance to run the operation to next year, the first quarter of 2026. This has been an issue, and I think the notice that was put out, it was a straight message to all the authorities that we can get assistance from. But so much has been said. So the management that we had gathered this morning, we had some discussions already. So now we are trying to go to media press. So we want to put facts right so that the people of Jiwaka, Papua New Guinea, the central agencies, the Department of Health, the Minister for Health, everything, they must understand our position, what really has happened in our system. So that is very important. So this is the whole reason why we are gathered together. But the CEO for Nazarene General Hospital, Mr. Sika, and Dr. Ben, to say at least a few remarks so that I can continue. Thank you so much.
Hospital and Nazarene administrators, we're here to actually come in a roundtable discussion to talk about the funding issues that is facing the hospital operations. What has actually brought us this far is because of the media release that was actually released on Tuesday, on Monday of this week. That has caught the attention of a whole lot of people. There's a lot of speculation going out there. And our coming here is to give assurance that we have not been directly targeting any specific person or an organization, but just to tell the public that this is the dire situation our hospital is in and we needed assistance. However, we are so sorry that the issue has actually gone out of hand, and many people have made a lot of remarks, both positive and negative, which we believe is all for the good of the health of the people of Jiwaka. And so our gathering here is to tell the public that we are here to iron out and see how best we can be able to move forward from here onwards.
Thank you, Mr. Sika, CEO of Kudjip Nazarene Hospital. Dr. Ben, you want to say one or two things? If not, I can continue from here.
I think maybe I just make a little thought, that's all. Mipla like walk boom one time. Mipla don't like throw my finger. Mipla got big plan in this start. Look out the music man, Mary Blow Jiwaka. So Mipla come, walk boom one time. Mipla got little aswa, lo side lo time Mipla releasing statement. I think this kind statement behind Mipla can walk him one time PHA. Also Mipla he got Bell lo help him that's all. You know, so Mipla no stop lo side lo politics. Mipla no stop lo side lo throw my finger. And Mipla like Pining Road lo look out the music man Mary lo this province. Na I'm Bell na thinking lo Mipla. So I'm stop backside, lo notice blow me plan, and me just like making this plot of that's all. Thank you.
All right, thank you so much. Jiwaka Provincial Health Authority management team, thank you for coming. Nam good long immigrant is like I think so. Me almost illa come to sorry na intention illa got long and straightforward. So one of the people make you illa all can accept it. You yet one la team. Now what is something now where you put him long media now I must be more true plan as threat but now not one la thinking and stuff backside. So all people belong to Jiwaka public even authorities, minister, treasury, finance. All the line look out him on high office or two must look. Now one and help him or can give him or two must give him so that you can finish him or like something. So once again, thank you so much for this one. Now two also me talk sorry. Your intention is straightforward. You wanted to get help from all the parties concerned so that you can continue your operation to run the services so that the people of Jiwaka and Papua New Guinea can be well served. But we are getting all kinds of criticism from people who don't understand the system better, and they are putting us in a chaos situation. So today we want to clear this once and for all so that this thing cannot happen. And also I'm happy that what we said is you are accepting it. In the future we will work together as a team. Anything that we want to go public, we will do together as a team because we are one team. So I'm first story problem also. Secondly, the people of Jiwaka, National Department of Health, Minister, Secretary and SCM members, Finance, Treasury, National Planning, all the stakeholders, Jiwaka Provincial Government, District Development Authorities. The first thing that we want to get it correct, straight into the minds of all the people is that Kudjip doesn't come under Jiwaka Provincial Health Authority. It's a church institution. And it has been operating for more than 50 years, and it will always remain as a church health facility. And the important thing and the concept that we have to understand is that they are our major partner. We are working in collaboration with Kudjip Nazarene Hospital. And because we don't have a provincial hospital, there is an MOU in place so that we are doing our best to assist Kudjip so that it can serve at that level. And this is something you must understand. So what we are trying to do now is to make sure that we have an amicable arrangement so that Kudjip can get direct funding so that it can suit its needs. So but my board is something over the one thing was okay. Kudjip staff underneath the Jiwaka Provincial Health Authority. Now this is was a partner. And partner from Nibla so Nibla work in cooperation with the MOU that is in place so Nibla work on supporting one another. So at first thinking I was declaring long Yumi public. Okay, second talk like Maggie is coming back to the intention of closing down the hospital if they don't get sufficient funding, at least 5 million kina to run the operation till first quarter of 2026. And this one is a general call, and Jiwaka PHA and Midla too in support of their call. So I declare that Kudjip, yes, it's being inadequately funded. So that message is clear. Or thinking the confusion or some old money that na kind can talk only making na Midla name no good and slack and something is that we are not hiding anything. So budget submission we do it together as a team. And what we submitted to Treasury, okay, all operations on making so Kudjip was 11 million. 1 million kina is for goods and services. 10 million is personal movements. So when we look at this funding, it's not sufficient to run a level 5 provincial hospital. Kudjip needs 7 million or more for the operational, and personal movements needing more, 20 million plus. So that's the realistic budget. Okay, the misconcept or misunderstanding people having is that we have information that is released by Treasury Department. And all operations and people action long idea was Jiwaka PJ and was 30 million plus. And then warrant release them was 18 million plus. So this information from Treasury is accurate. Now Mibla counter check what then the report we have, so this information is correct. Okay, the misunderstanding is that people thinking that okay, this 30 million kina is coming into Jiwaka Provincial Health Authority. This is totally wrong information being circulated. 30 million kina is the appropriation. Warrant or release him 18 million. Now when you look at about 18 million, people must also understand that in Papua New Guinea, the budget that the sector area that consume most of the funding, government grants, is personal emoluments. Paid long get a work man marry. It's consumed by 80%, and that is fact. No one man by denial on this plan. So now also appropriation of 30 million. Actual warrant release is 18 million. So about 80% of that money is going to salary. Mibla servicing workforce long Jiwaka Provincial Health Authority. Money paying now running health center na all that something more right na yumi amas like you start here. So disaster Kudjip not facing here. And money operation you do so pay problem yumi got we will have black. Or the problem is even go black when it's talking about one time Jiwaka even go this crisis we will have a black day and it's going to go down in history. So this is what talking more than the man was clear. So big money we go to salary from workforce. The legal class only less than 20% is coming to our operations. So we are kissing around him. So we look at community services where Kudjip become along, public health director staff, corporate staff, plenty something people are making of this something. So and this like misleading information. So now we correcting so people got to understand that clear. The second, I think Minister Mitoto won the 7 million of floor of Parliament. And this is submission is Kudjip only making so now. This is for 2027 or 2026. Or Kudjip issue now also Mibla Panama also they were inadequately funded. So long midterm review, Mibla may want a good presentation, the best presentation. Treasury, Finance, National Planning, National Department of Health, all staff na Mibla talk all get something na position of Kudjip. Now on this 2026 position now at Parliament session. So anytime soon appropriation of Kudjip will come out. So now Mibla Mibla appeal on Minister of Health, Mibla appeal on Treasury, Treasurer, Mibla appeal on Minister of Finance. Please look good long budget long Kudjip appropriation here. So now look and go long this like an heavy. So Jiwaka PJ Mibla give more support Kudjip come Mibla make him go on number so personal enrollment is about 20 million Mibla putting. Goods and services and 7 million submission Mibla making. So appropriation must come good next year so that Kudjip will not have to go inside long. This like an heavy now because it plenty inconvenience to the people of Jiwaka and the rest of Papua New Guinea. Now two also and put it better too long also long management. So National Department of Health, SCM, take that into consideration, do advocacy, make sure that we get this kind of funding. So I was some also me clearing. Now Kudjip was talking two because this 1 million is not enough. But thank you also more church as facility only got Narabla source what success so then Mibla Jiwaka PJ or legally something come Mibla give more Mibla boom what make him go no survive become so that notice or put him in was intention is to seek funding support. Only to Jiwaka Provincial Health Authority, provincial government, district development authority. Okay, what else? National Department of Health. They are rightfully because we are stakeholders. We are supposed to fund. So now on the hand of may give you the district development authorities, BSIP, we signed an agreement that you are going to support Jiwaka Provincial Health Authority with Kudjip Nazarene Hospital. The then Health Minister, Dr. Tom Lino, came to Kurumul, we signed it. When we are going to your steps, you have your own shopping list. You are totally blamed for this chaos in Jiwaka province. Jiwaka PhD as a Miblak name no good nothing now. You lay a smile and stuff was a child and pirate some kind of something stuff. So today that sort must come from the district development authorities, the provincial government, making money available now is probably so next week just 5 million or 10 million give it to Kudjip Nazarene Hospital so they can run the operation. And straightforward. So Jiwaka started coming clear and it's crystal clear, Kudjip understand how much lower people give, so now we are kind of stuck in between. So 30 million kina you don't know and wrong to making and appropriation. The 18 million and people are convinced, but then also 80% of that money is going to personal movements. We are getting less than what you people are thinking. So I want something was made clear. me clearing no imi all get so me play boom na talk lo is something so parties when me call him name lo and now almost come good na straighting all get is something so the recommendation that we want to put through and was the National Department of Health, Minister, SCM, Treasury, you must take into consideration seriously, and also the Department of Personal Management is that by Wednesday next week, we are sending a delegation. So we want to see that Kudjip must get item workload and must be created ASAP before the appropriation is made for 2026. So the budget something Kudjip must come straight. So yet was 7 again. So you know, good local some Jiwaka money no come as a Miblak's name, no the name title it must stop today once and for all. Once and for all. So me like him by this was something about please must fix him ASAP because me later to talk one jail. So our team from Jiwaka they're coming down. Our technical officers assist him also that we must create an item code for Kudjip Nazarene General Hospital ASAP so that personal emoluments budget, goods and services, what is being appropriated will be appropriated for 2026 must come straight to Kudjip. So that only must look him, Amazon can work and something for PJ, people must make him work, it. So I'm still like some people make him also by him stopping plenty or kind of thinking and stuff. Otherwise, people one team. Now we have been the best partners. We will never separate Jiwaka PJ from Kudjip because they are our great partner. We will work in collaboration in whatever ways we can assist and we will help him more, support him more. So that one fine day, all but come, the system will all by standardize. I think what in this plan was some like thinking like kindness and become long and also me clearing today. So Jiwaka PJ has got nothing to do with Kudjip. One if something comes also me planting. It's the system itself. It's a system itself. The system failure is causing inconvenience now, all kinds of issues coming up. So we need to fix the system. Now part of that blame, okay, and National Department too much carrying because the technical team you must certificate for Kudjip. It has been evident because in the review also me when the team people go at one whole presentation, you are not talking very hard out like something. So now it's the time you do it. Okay, no. Conclude more than something and maybe like some talk somewhere also and some last assistance or some more treasury and one of what the more listen or talk some money by council and whatever was only given and normal something so we will give it to Kudjip so that all the sustainable operations some people are giving less than what is needed on district development authorities, provincial government, you may assist them okay. National Department level 2, you will have some road long kiss money too. Along helping by yourself, only can continue operation long. And finally, I would like to say thank you to the Finance Treasury Department. You have taken into consideration and just today I received a phone call and also a warrant has been released. So we're happy. So that money, when it comes to our system, we make sure that what is allocated for Kudjip will give it. And we still have shortfall, we will find money somewhere so that we top it up to the balance that they need. So we will run the hospital. Now Operation Bagwana, then we must wait on 2026 operations. I think what the display was no had more talk and was some thinking and misunderstanding and stuff like that was a Mibla clearance. So Jiwaka PHA leadership management has got nothing to be blamed. We are crystal clear, Kudjip yet and what Samuel on display. But Kudjip was intention only no making what the something of Bagram Mibla Jiwaka PHA no that only short points so I'm more right because only talk about people from this province. And what they said was right. So sometimes something and Mibla 18 too am right, but now was an information and come loud and clear. What is this? Thank you, Lord. Ari bring you get so talk and come out and thank you. They will go. It's basically to seek advice and technical support assistance from Treasury, Department of Personal Management, especially in finance, so that we must create a item code for Kudjip. Because we submitted the budget already, so the appropriation will come. So we do not want Kudjip money to come to come under Jiwaka PHA. It can come, But we must have an item code under Jiwaka PHA so that they will know exactly how much is coming into the system. Being good and services. So when it comes, and when it's somewhere so they manage their funds. So I'm also make that's one. Okay, drug shortage. It's a very, very interesting issue now in the country here. Okay, the first point that I'm going to get here to the media is that the procurement function is under the National Department of Health. Jiwaka PHA or all other PHAs in the country, we don't procure. This function, all funding is made available to the National Department of Health, so they go on tender and they procure drugs. And drugs, they send it through our area medical store, Long Humid Islands and Stablohagenia. So what we now is we look at provincial pharmacists. We have people, so the officer in charge of the health facilities, Kudjip Nazarene General Hospital. We do drug orders, and then we go collect our orders from area medical store. Okay, now it's a nationwide issue. So when we have an issue like this in Jiwaka, the people should not pinpoint at us because we are not at fault. It's the department, the government of Papua New Guinea. So it's like procurement function and you mean no cut. But for Jiwaka and Kudjip Hospital, other countries when they're talking about drugs, people all the time, people are trying best from people and people are keeping all our facilities in operation. Kudjip will get own way to also Kissing or Marashi supply come and then still they're serving the people of Jiwaka. And for Jiwaka, we get this grants that is coming in. No, it's not massive forward because when we close down the health facilities, people will come and they will make another BTC. So that understanding and people must try best. So because I got some arrangement with the pharmacies that we have. So people are servicing on credit basis. Some of the time people got money. And something money go to this road now. So people are too and people like some people are problems. So people are spending some of their money. So we do not want to talk because we have to do it. If the country cannot purchase the drugs, okay, we have to do it. So we are responsible. So and also we talk clear. So functioning is what we about. Another important recommendation from Jiwaka Provincial Health Authority, including Kudjip Nazarene Hospital. We have a recommendation. The National Department of Health must speed up that process. Important thing is they have to release or delegate this function to the PHs. Procurement process of function and people have to control them, so they must give us the money. So we have provincial government, we have district development authorities. So we know what to talk now. We manage our own supply system. And one way you make it now, only something more right. So something here also, parent department and morning passing yet now. And posting plenty everywhere. So it's something and make it now. We not very much. Present medical store, we are doing our structure. Taking that in the future, they have to transfer this function to all the PHs. So come, okay. And we are ready to manage our own drug supply. So I'm also supply because we have Kudjip, so only got one way. So and people can move and then no, okay, we can manage that system as well. Thank you so much.
Thank you, CEO.
Yeah. Until and unless the funds actually in our books, then we will make another statement to change how we have actually said it. So as it is now, the statement still stands.
Outpatients do not close until first week of December.
Okay. Now we look at what it is, so we know what's good looking, but we make sure that Kudjip should open. People something straight also, we are giving assurance. So we make sure that our hospital must open, and that is very, very important. So the people of Jiwaka, they need clinical services and bigger something. But people are so poor and we talk here also. People are provincial government staff, district development authority staff, self-level agreement, people are working so. Only there was 1 month, 2 years, so people are working. So almost 3 years, some decision belongs to health. 2 minutes.
So up to now, none.
Nothing. Don't give him 8 million here. For the last 5 years, I won't give people a bloody money. Some people have Kudjip Nazarene, people have Chimna. People by 1 billion, people all more. Easy. Very simple. Okay, and so going to trace here. Tracing appropriation also making. So this is a submission, even though some looking also, and people all get on need is one clear or something here. So all go now make him kind get to. So what information I'm giving is accurate. Submission of those because I'm making submission on March, May around there. So go now, okay. No, not here. So Kudjip submission long and we talk about Tunisia. So I'm got treasury. So treasury that was operation of giving me long end of this year. This is so next year. But look, 2025 operation was a meet of how this year. 10 million, 11 million, 1 million, I'm all the story I'm not significant. I'm kind of.